अस्सलाम वालेकुम इयाका नअब्दु व इयाका नस्ताईन। वेलकम टू माय चैनल डॉक्टर शामी सेज। तो आज की इस वीडियो में रेडियोलॉजी 21 नवंबर मॉर्निंग का मैं पेपर करने जा रहा हूँ। सो लेट्स स्टार्ट। क्वेश्चन नंबर 1, द सेरिब्रल डैमेज साइन इज द दिस metria, which of the following lung volume or capacities can be measured by the spirometry, that is vital capacity VC. Option number E. A young boy came in the ER with a profuse bleeding from the minor trauma. He has this complaint for the last 6 months. There is no family history. He has also chronic diarrhea. Bleeding time 6, clotting time 30 minutes. Most likely cause would be the vitamin K deficiency. 11-year-old girl was sent to radiologist for the X-ray elbow joint to diagnose the age. The secondary center of ossification last to appear in the humerus would be the lateral epicondyle. The regarding blood supply of the brain. The branches of the cerebral artery don't anastomose after entering the brain substance. The female patient presented with the panhypochondrium. Exploratory laparotomy was done, which showed that the ovaries were attached to the lateral pelvic wall. Which structure in this area has increased risk of damage in the procedure? That is the internoiliac artery. Unmyelinated nociceptors, primary afferent fiber synapse directly, which neuron of the spinal cord, the spinothalamic neuron of the lamina 1. Edema of the renal origin is most likely due to the albuminiurias and the sodium retentions in extradural hematoma. Artery involved will be the MMA, middle meningeal artery. The oral membrane or the buccopharyngeal membrane separates the stomatium from the foga. The plasma proteins filtered in the minute amount from the kidney because filtration is opposed by the membrane due to the negative charge of the proteoglycan on the basement membrane. The 17-year-old man with the renal transplant 2 years back, now presenting with the complicated pneumonia, not responding to antibiotics, bronchoalveolar lavage, shows the boat-shaped cyst. The organism causing the condition would be the Nemesis gyrovesi, which bacteria has no cell wall. That is definitely beta, which is the mycoplasma. The theophylline cause more effect in the children in due to the decreased excretion. Cimetidine given before the surgery because decrease the volume of the gastric acid. The diabetic patient presented the OPD with the oozing greenish discharge from the wound. Which of the following is the causative? 15. Cimetidine given before the surgery because decreased volume of the gastric acid. The diabetic patient presented the OPD with the oozing greenish discharge from the wound. Which of the following the causative agent? That is the pseudomonas. Pale infarct in the heart as a result of the MI is related to which necrosis? That is the coagulative necrosis. The coronary village sampling is done at which week? That is 11 to 12 weeks. The RBC synthesize ATP from the glucose. Glycolysis enzyme present in the cytoplasm of the RBCs. Intramitochondrial protein synthesis by the nuclei gene. The 2-month-old baby cause lose motion after every feed immediately due to the gastrocolic reflux. The drug of choice of the tapeworm would be the nicosamide. The plasma protein synthesized by which of the following? That is the liver. The prozone phenomena is the antibiotic body access. Nerve damage between C5 and the C6 would be C6. Next, woman having the lordosis. This involves which part of the vertebra? That is the lumbar. Latissimus dorsi nerve supply would be the thoracodorsal nerve. After gunshot injury to the lower back, patient has loss of the contralateral pain sensation but intact temperature sensation. What is the likely diagnosis? Section of the dorsal root. S1, the patient with the right-sided hemiplegia, left-sided pain and the temperature lost below T8, while the right side proprioception and the touch sensation lost below T8. The cause would be the hemisection at the T8. Next, question number 29. The patient with the enlarged hand and the feet with the SSC joint on the MRI, mass compressing of the chiasma was found that can occur due to the bitemporal heminopia. The patient has the raised prolactin, the bilateral temporal vision loss due to the defect in the middle optic chiasma. The gunshot wound injury result in damage of sciatic nerve, which muscle will be sparred. That is the gluteus maximus. The celiac trunk branch would be the common hepatic artery. 24-year-old married female having secondary amenorrhea, her FSH, LH are high. The pelvis does not show any abnormality. What could be the possibility? That is the gonadal failure. The edema in the liver cirrhosis patient is due to the decrease on call pressure. Next, the diabetic patient present with the nausea and the headache who is receiving the antidepressants because the polyuria came with the decreased sodium. Cause would be the nephrogenic diabetic insipidus. The patient has the lipoma on the posterior aspect of SCM, the 5 cm relation to the sternoclavicular joint, which structure ligated in the profuse bleeding. That would be the second part of the subclavian. The lower molecular weight heparin activate which of the following? That is antithrombin 3. 35-year-old female presents with a 6-month history of the fingers turning pale in the Colinas phenomenon and having the dyspnea with no V's, tight skin and the mild enlarged spleen, creatinine in the high, urea, ANA positive, HP 10, TLC and the white platelets normal. What would be the diagnosis? That is scleroderma. Next, 39, the patient at the high dead space of one third of the tidal volume, participation of carbon dioxide, the venous blood is 45. What will be the ET of the carbon dioxide? That is 30. The side effects of the dicumarole would be the delayed clotting. Next, the mother milk is deficient in the vitamin C. The systolic phase of cardiac cycle correspond to the which of the following component of the ECG? That is the QT-RT intervals. 45-year-old presented the sudden onset retrosternal chest pain with the sweating and the breathlessness. Examination BP was 90/60 and the pulse was 110. Low volume. Most likely diagnosis would be in this case that is gonna be the MI. Next, regarding the preferential thoroughfare channels, the correct statement would be the having smooth muscle, the adrenal secretory adenoma leads to the hypocalcemia, the lymphatic drainage of the external nose, anterior part of the nasal cavity, the submandibular lymph nodes. The female with the sign and symptoms of the hyperprolactinemia was diagnosed the pituitary adenoma. The growth of this tumor entirely will compress which structure? That is the optic nerve. The man's support of the pelvic viscera is the levator ani. The melanoma invade optic cavity through the imagery vein, and the anti-GnRH hormone secreted in the dark would be the melatonin. The most potent antioxidant is the vitamin E. The patient presented with acute painful swelling the front of his ear. On examination, pituitary gland is large nerve is involved, basically the greater auricular nerve. Next, 53, right shift of the oxygen dissociation curve is due to the increased hydrogen ion. The sea diver after driving developed the shortness of breath and the joint pain. The cause would be the nitrogen bubbles in the blood, which is not oncogene, and the cause gene amplification, that is the APC. Right lower limb paralysis is caused by the ACA. 35-year-old male usually goes to Dubai and has a history of immoral activities and doesn't urine production. He has a problem the walk in the dark and loses balance after absent light reflex, no pain sensation. Most likely diagnosis with the tabes dorsale. The patient after artery having urine incontinence, which segment of the spinal cord would be damaged? That is the sacral segment. The upper motor neuron region of the facial nerve, all true except would be one eye spot. The person with the difficulty in swallowing, there was some white growth inside the esophagus with the pseudohyphae. Likely reason would be the candidiasis. Regarding the erythrocyte, true is the increased viscosity of the blood. The CA pancreas patient is admitted the ward. His brother is not letting tell the patient that the patient has cancer because according to his brother it will kill the patient even father at the evening. The patient's family is going to come to hospital to discuss and we will have to conference together. What we will do? Tell the brother that it will be dishonest to the patient's family and the medical staff. The vessel at the base of the bladder lies in which ligament? That is alpha, the dorsolateral ligament. The 6-year-old child presented with a weakness and lethargy, MCV 59, HP 6.8. This is the iron deficiency anemia. Hypospadia is the abnormality of the urogenital falls. A study involved to rule out the cause of the rare disease is the case control. The median episiotomy, perennial body is damaged. Perennial body cut, which muscle will be damaged? The bulbous spongiosum in the superficial transverse brain, which is the falling is leads at the synapse between the incoming pain fibers and the pain inhibitory fibers in the CNS spinal cord, that is the enkephalin. Patient is taking warfarin and starting to bleed, which is what is the treatment? That is the vitamin K and FFP. A girl during the menstruation developed the high grade fever because she was using temples. Organism responsible would be the Staph aureus. Female presenting the cauliflower likely against the perineum, and the diagnosis of the condyloma acuminatum made it is caused by the HPV. Female 17 years old with the primary amenorrhea, absent secondary sexual characteristics. On examination developed normal breast and blind vagina, ultrasound absent of the uterus. This would be definitely beta, which is the testicular feminization. Next, the early diagnosis of the preeclampsia is done by the early baby monitoring, which is the preeclampsia triggering factor. That is a fetal endothelial dysfunctions. How many days take for the spermatozoa from mature sperm? That is 75 days. Intrahepatic protein metabolism, extrahepatic catabolism of the cortisol in hemostasis. The word GAN is for the exaggeration of the clotting mechanism. Aspirin, the lower dose inhibit which of the following? They inhibit thymoxane 2. Therapeutic dose of the drug indicate the potency. Next, the patient presented with the peripheral tingling, numbness, diplopia, and the visual disturbance. Diagnosed the demyelination disease, wet type nervous system affecting this is the oligodendrocytes. Patient had the cough and X-ray shows the hilal lymphadenopathy, non-caseating granuloma, definitely sarcoidosis. The pregnant lady presented the rheumatic fever, which is the characteristic feature of the rheumatic fever in this lady. The mitral stenosis, the child having hydrocephalus with the defect in the arachnoid granulations. The canon A wave is associated with the complete heart block. Next, in which condition there is no relation between the P and the QRS complexes? That is the complete heart block. The artery pulpati between the trachea and the sternohyoid is the common carotid artery. The superior thyroid artery originates from the external carotid artery. The chronic pressure overload in the left ventricle to the aortic stenosis results in the left ventricular hypertrophy. Heart failure is commonly associated with which of the following condition? That is the fibrinous pericarditis. The female came with the schizophrenia, BP 110/70 using drug phenothiazine, or this now presented the milky discharge from the impulse. What is the cause? That is the drug induced. Highest chance of the pneumothorax occur while passing CVP line would be the subclavian. When the patient came in the ER, the chest pain is normal. normal cardiac enzymes. Normal doctor advised thoracic cage X-ray. Which of the following structure is cartilaginous per amphiarthros joint is the costochondrial. 93. The pericardicency is best performed by passing a needle through the fourth and fifth intercostal space left of the sternum. Cell wall of the gram positive cause septic shock. Which component of the cell wall caused the shock? That is the peptidoglycan. Next, young male had an RTA resulting in the femur fracture. Died 5 days later. Autopsy showed cerebral petechias. This is the fatty embolism. The patient, the history of the severe chest pain, crushing in nature, reaching the left arm of the two or duration ECG is inconclusive. Which cardiac enzyme will be raised? That is the myoglobin. The hypertrophic cardiomyopathy typical feature is the myocyte disarray. The athletes will have the increase in the stroke volume. Athletes with having large heart comparatively in the increased stroke volume instead of their muscles need same amount of energy and having cardiac output approximately same as there is a normal individuals. What can be the reason for this phenomenon? That is the decreased heart rate and increased SV. Fastest mechanism for the BP changes is the baroreceptor. After an hour, what affects massive blood loss, a patient goes shock, MAP less than 60. What will activate now? That is a CNS ischemic response. Cytokeratin is an intermediate filament found in cells that is most commonly used for the detection of the neoplasia. Carcinoma of the cervix is diagnosed by the invasion of the basement membrane. Feature of the mineralocorticoid tumor is the hypokalemia. After ovulation, the oocyte is in which phase of the cell cycle? Prophase of second meiotic division. The granulogastrocnemius size is reduced after fast supply for the few weeks of the fracture is most likely due to the decreased protein synthesis and increased degradation. Features of the well-differentiated squamous cell carcinoma is the keratin pulse. The patient has an AFib and MI in autopsy. What is the finding? That is the prolonged immobilization. The patient of the cervical lymphadenopathy, chest bilateral hilar lymphadenopathy. Biopsy shows the typical granulations and necrosis of the mandibular and sublingual glands. Diagnosis would be the sarcoidosis. What is the placebo effect? That is the subject does not know the drug. Immunity against the COVID-19 tumor cells is of the NK cells. The girl with a blister on extremities type of flood present between the dermis and the epidermis would be the serous. Patient is in the radiotherapy after the DNA damage gene which next in G1 ways of the progression defective unregulated growth occurs due to the P53. The carcinoma that suppresses the vertebral arteries has which marker? That is the PSA. The next security guard gunshot injury on the lower back. After physiotherapy rehabilitation, he has lost contralateral pain, temperature below the level of being and ipsilateral loss of the vibration. What is the diagnosis? That is the Brown-Sequard syndrome, which inhalation anesthetics cause a greater decreased vascular resistance. That is a halothane. Stitching tube epithelium would be pseudostratified columnar ciliated. Woman presenting with the valvular itching in the pinkish pool and discharge. What is the cause? That is a trichomonas vaginalis. The female patient with a pain in the first metatarsophalangeal joint is due to the gouty arthritis. 120. The microtubules are present in the centrioles. The best host defense in the alveoli is the alveolar macrophages. The regarding fetal HB true would be the more oxygen binding capacity nor norepinephrine senses required. Which enzymes? There's a dopamine hydroxylase ADH act mainly on the distal tubules. Right ventricular characteristic feature is the pulmonary trunk arises from it. The Brodmann area 3 to 1 is the receive all somatosensory sensations. The sodium absorption from the basal lamina of the kidney is the sodium potassium ATPase from the yeast species that are resistant to echinocandins or the Candida auris. Patient came to ophthalmology clinic with a complaint of the gradual loss of V in his accommodation. Reflux were present, but the light reflux were lost. The encephalitis, the regarding Hodgkin's disease is the male have the better prognosis. The dobutamine opposed by the labetalol, the anthrax drug of choice is a ciprofloxacin. The group of students were studying difference between the perspiration oxygen carbon dioxide and the different arteries of the body. They find major differences between the aorta and the pulmonary artery. The case of the ERDS, the ventilation is hampered as a result of the intestinal edema due to the increased capillary permeability. 135. The difference between the root of the right lung from the left lung is the number of the primary bronchi. The diagnosis of pendicular tumor which has the mucinous secretion called the myxoma peritoni will spread descending to the other side. The vitamin K deficiency causes increase in the PT. Next, the patient cannot recognize objects which with the closed eyes. The lesion is in the secondary sympathetic area. The sympathomimetic drug is which one of the following? That is the amphetamine. 60-year-old girl present the OPD with excessive facial and the chest hairs. Adult size extensor deepening of voice. She also gives the history of the two siblings' death suffering from the same condition. Which enzyme deficiency lead to this? That is 21 hydroxylase deficiency. 141. The HSV2 cause which of the following? That is the C. 142. The conducting system of the heart is located in which of the following? That is the subendocardium. The heat loss is controlled by the preoptic area. The female with the fever in the sore throat. 60% beta lymphocytes and BT lymphocytes normal percentage in the blood. would be the T lymphocyte 80%, 80 to 90%, beta lymphocyte 10 to 20%. The inquired respiration muscle, which increase the vertical diameter of the thorax, is increased by the diaphragm. The hinge bodies are found in the G6PD deficiency. Next, the development of the breast area in the lobules is the function of the progesterone. The patient exhibits the signs of myasthenia gravis. The best confirmatory test would be the EMGs. Good doctor-patient relationship requires the active listening. The increased extracellular calcium cause which of these? There is a systolic arrest. The mineralocorticoid screeching tumor serum findings would be the hypocalcemia. Thank you for watching this video. Pardon for these few background noises. Do subscribe my channel. Until my next video, Allah Hafiz.